Want to score over 850 in your MedSurg Hesi? Then let's get started. Today we'll be covering 10 questions based on the Integumentary system. Question 1. A client is diagnosed with psoriasis. Which finding would the nurse expect to assess during the physical examination of this client's skin? Red, swollen vesicles, thick, silvery scales, honey-colored crusts, circular patches with central clearing. Pause the video and select your answer. The correct answer is B, thick, silvery scales. Psoriasis typically presents with thick, silvery scales on red, inflamed skin patches. You can pause the video and go through the incorrect options. Question 2. Which condition is characterized by the presence of fluid-filled vesicles and intense itching? Psoriasis, eczema, impetigo, herpes simplex. Pause the video and select your answer. The correct answer is B, eczema, also known as atopic dermatitis, often manifests as fluid-filled vesicles accompanied by itching. Question 3. Which skin condition is caused by prolonged pressure leading to ischemia and tissue necrosis? Acne, dermatitis, cellulitis, pressure ulcer. Pause the video and select your answer. If you chose option D, you are correct. Pressure ulcers, also known as bed sores or decubitus ulcers, result from prolonged pressure on the skin, leading to tissue damage and necrosis. Question 4. A client presents with a suspected fungal infection on the skin. Which assessment finding would the nurse expect to observe in this client? Circular scaly patches with central clearing, red swollen vesicles, thick yellowish brown crusts, linear burrows with excoriations. Pause the video and select your answer. The correct answer is A, circular scaly patches with central clearing. Circular scaly patches with central clearing are characteristic of fungal infections like Tinea corporis or ringworm. We're halfway there, guys. Let's keep going. Question 5. A client with severe burn injury is at risk for developing a pressure ulcer. Which action by the nurse would be most appropriate to prevent pressure ulcer formation in this client? Applying heating pads to affected areas, repositioning the client every 2 hours, massaging bony prominences regularly, encouraging the client to sit for extended periods. Pause the video and select your answer. If you chose option B, you are correct. Repositioning the client every 2 hours. Repositioning the client every 2 hours helps to relieve pressure on bony prominences, reducing the risk of pressure ulcer formation in clients with severe burn injuries. Question 6. A client with diabetes mellitus is admitted to the hospital with a foot ulcer. Which nursing intervention is the highest priority for promoting wound healing in this client? Keeping the wound covered with a dry dressing, elevating the affected foot above heart level, encouraging the client to soak the wound in warm water, monitoring blood glucose levels closely. Pause the video and select your answer. If you chose answer D, you are correct. Monitoring blood glucose levels closely. Close monitoring of blood glucose level is essential in clients with diabetes mellitus to promote wound healing and prevent complications like infection. Question 7. A client is diagnosed with contact dermatitis. Which teaching point is essential for the nurse to include in the client's education plan? Avoid scratching the affected area to prevent infection. Apply a warm compress to the rash to reduce inflammation. Use over-the-counter hydrocortisone cream liberally. Identify and avoid the trigger substance causing the rash. Pause the video and select your answer. If you chose answer D, you are correct. Identify and avoid the trigger substance causing the rash. Contact dermatitis is caused by exposure to an irritant or allergen, so identifying and avoiding the trigger substance is essential for preventing further outbreaks. Question 8. A client with a suspected skin infection is prescribed antibiotics. Which assessment finding indicates a therapeutic response to the medication? Increase in size of the affected area, development of new pustules, decrease in redness and swelling, worsening of pain and itching. Pause the video and select your answer. If you chose option C, you are correct. Decrease in redness and swelling. A therapeutic response to antibiotics for a skin infection would include a decrease in redness and swelling at the affected site. Question 9. A client is diagnosed with basal cell carcinoma on the face. Which characteristic is typical of basal cell carcinoma? Rapid growth and metastasis, irregular borders and varied coloration, pearly or waxy bump with rolled edges, flat, fresh colored or brown scar-like lesion. Pause the video and select your answer. If you chose option C, you are correct. Pearly or waxy bump with rolled edges. Basal cell carcinoma typically presents as a pearly or waxy bump with rolled edges and may have visible blood vessels. Question 10. Way to go, guys. You made it to the end. A client is admitted with a suspected allergic reaction to a new medication. The nurse assesses the presence of urticaria on the client's skin. What is the priority nursing intervention for this client? Administering epinephrine subcutaneously, applying a cold compress to the affected areas, discontinuing the suspected medication immediately, providing reassurance and emotional support. Pause the video and select your answer. If you chose option C, you are correct. Discontinue the suspected medication immediately. Urticaria or hives is often an allergic reaction to a medication or other allergen, so discontinuing the suspected medication is essential to prevent further reactions. Congratulations, you made it to the end. Click that subscribe button and join us next Monday for another MedSurge series.